Good morning. Can you hear me? Yes. Phew.
Yes, we can.
I'm sorry. I got held up in another meeting and I'm terribly sorry to be late to this one. Thank you all for your patience. And then, of course, I had trouble logging into WebEx. So I wanted to welcome everybody to this meeting. Thank you again for your patience. I am delighted to be able to be here with you and to have everyone participate. We are excited to be with you. And my name is Emily McClellan, by the way. I am the director of the Policy, Regulation, and Member Engagement Division, which includes Natalie Pennywell's group. And I am going to turn it over to the other DMAS leaders and on the line, including Natalie. And we want to welcome also our presenters. So Natalie, do you want to introduce yourself really quickly and we'll let you kick it off?
Absolutely. My name is Natalie Pennywell. I am the Outreach and Community Engagement Manager here. We also have a couple of members from our administrative team. If Miriam could introduce herself as well, that'd be great. And then if you could introduce yourself via the chat, we love to know who is in the room today. Just drop your name and your organization and why you love fall. That would be wonderful to know as well. So I'm going to turn it over to Miriam to introduce herself.
Good morning, everybody. My name is Miriam Siddiqui. I'm a Senior Operations Advisor in the administration team at DMAS. We're looking forward to all the great conversation today. Thank you for joining.
Great. So the purpose of our meeting today, after having such great interactions with you all this summer, we really wanted to create a space where we can have an ongoing meeting with our stakeholders, our partners, our advocacy partners, so that as different things come up, as different subject matters come up, that we have a space and time that we have dedicated to presenting to you any updates, any changes, but also so that we can get some feedback about what's happening in the field, any gaps in places that we need to provide additional resources, tools, or services. And so this meeting will be taking place every other month on the, I'm forgetting the third. Is it the third one, Miriam? The third Thursday at 11 a.m. And I've already sent you all of the information. If you signed up, you have a reoccurring invitation through WebEx to come to these meetings. If you have anybody else that you would like to join, please don't hesitate to send me an email. Just drop their email in there and I'll add them to the ongoing list. If you want to be removed from the list at any point, just drop me an email as well and we'll do that as well. And if you have any questions in between or any feedback about what we should be covering as we continue to engage in these meetings, please also drop us an email or put it in the chat. We love to hear it that way as well. So I'm going to, at this point, turn it over to Jessica, who's a part of our wonderful team, and she's going to engage in a discussion about public health emergency planning. Thank you so much, Jessica. And you can please introduce yourself at the top of your slide.
All right, good morning, everybody. Can you hear me? All right, thank you. All right, good morning. I am Jessica Anacini. I'm the Senior Policy Advisor to our Deputy of Administration, Sarah Hatton. Sorry she's not able to join this meeting. She was in another meeting. However, hopefully we can look forward to having her come to another one of this meeting series in the future. So I will be here today to focus on the Medicaid Eligibility and Enrollment Unwinding Plan. We've been doing a lot of planning here at DMAS, and so we want to bring you up to speed on what we've done so far and how we can get everybody's help to make this a successful unwinding. So we'll go ahead to the next slide. Let's see, I'm not seeing the next slide yet. Oh, there we go, perfect, thank you. All right, so while it's not new anymore, it may be new to some of you that on August 13th, CMS, our Center for Medicare and Medicaid Services, they did give us some updated guidance on unwinding. The reason that this was updated is we did receive some guidance in December of 2020. Namely, that guidance pointed to a 6-month unwinding period, meaning that states will have 6 months to resume normal operations and bring all of their overdue renewals into compliance. Now, the August 13th updates are not an extension of the PHE. They don't give us any specific information on when the PHE is ending. However, we have received information, and actually one thing that's on the slide that was true at the time but now has changed is we have received a new PHE extension. It was actually effective on October 18th. It is for the full 90 days. And so now we are scheduled for a new end date of January 16th. Now, of course, each of these extensions is not a true end date. The Secretary of Health and Human Services only has a maximum of 90 days with each extension. So there's no guarantees that January 16th is going to be the end, but this does fall in line with the previous guidance we were given that the PHE will last at least through the end of 2021. Now, with the guidance that CMS gave us back in August, the major change to that is that states are now being given 12 months to unwind. Now, that's very important because, of course, we have to touch pretty much every single member. We have a very large number of members that have not been renewed yet, that are overdue, or that will come due within that unwinding period. So that gives states an ample amount of time to be able to touch all of the members, reevaluate their status without bottlenecking renewals. And we'll talk about that a little bit later. We'll go ahead and go to the next slide. And this next slide basically just has an enrollment just to show a snapshot of how our enrollment has grown since the PHE started. Just to kind of give you an overall view, we started with about 1.5 million members at the beginning of the PHE, and we have just recently surpassed as well. It says 1.8. We've just surpassed 1.9 million. We do actually have a fair majority of that growth is within expansion. So you can kind of see that on these charts here. And again, we've just surpassed that 1.9 million mark. And we'll go to the next slide. So this next slide is basically everyone that we so far have been able to determine that we're going to need to touch. This is not a full data set. Again, these numbers are through October. We do get updates every month. We've not received the update yet for this month, so of course these numbers will be higher in just a few weeks. So as you can see here, the manual annual renewals. Now what this means is those that did not successfully complete ExParte. That is just the number of overdue renewals. This does not include any renewals that would be normally due in 2022. But as you can see on the slide, the number of cases is 377,000, but members are 644,000. I know that typically we think about our program as a member-based program. However, our eligibility system is based on our household units, and so that's why we also include that case information. Another big thing that happened during the PHE is, of course, the maintenance of effort. Now, the maintenance of effort is basically keeping everyone in the coverage they're currently enrolled in, regardless of changes reported. We cannot reduce or terminate coverage, nor can we ask for any additional information from our members to determine ongoing coverage. Because we are keeping the maintenance of effort, the state is entitled to an enhanced match rate of 6.2%. That means basically we get a lot of extra funds from the federal government to help us with our programs because we are enforcing the maintenance of effort. So as you can see here, these next groups that are on this slide, those are all of those individuals as well. So we have individuals who have aged out of coverage, and you can see, I know the numbers are probably a little small for you to see, individuals who turn 19, 21, or 26. Of course, because we've been in the PHE so long, some of these individuals have turned 20 and 22 and 27. And so we do have a large number of individuals to reevaluate. And then, of course, we have our individuals who turn 65 and individuals a couple slides down, a couple spaces down that have received Medicare coverage. One of the big reasons we cannot reevaluate those individuals is because, of course, that comes to covered groups with resource tests. Since we haven't asked about the resources, we cannot send information out to ask for that additional information. And then another large group are our pregnant individuals who have reached the end of their postpartum period. So you can see, even though we have the larger groups, the charts will break down by the specific groups and the numbers that we're looking at that we need to reevaluate. Now, one thing that we don't know the number, but we do know that needs to be reevaluated are individuals who reported a change in circumstances. The reason that number is unknown could be because of many different reasons. depending on how a member has reported a change, we may or may not have that information in our eligibility system. So there could be information that's, sitting on a worker's desk at a local agency, could be within our systems, or may be held somewhere else. And so we don't know the exact number. I'll go ahead to the next slide. And so the next slide is basically just breaking that down in a pie chart. It's the same numbers that you saw on the separate slide, but it basically says, what is the number of individuals who have either aged out, other than our renewals, where do all of those individuals fall? So you can see 40% of those are those that have aged out at 19, 21, and 26. And then our next largest group is that postpartum period. And we'll go to the next slide. And of course, I did not say this at the beginning, but of course, please post your questions if you do have them. I know that we have a limited amount of time, so I did want to go ahead and get through the content. But of course, if we have a few minutes, I'd be happy to answer any questions. So the next part of the presentation is going into what is DSS or DMAS and DSS doing in order to prepare for unwinding. So we currently have a combined partial review process, and we work with DSS, Department of Social Services, as they own the eligibility system. What we have done actually during the PHE is we've expanded the process but not turned it on. So when we are in post-PHE, we are going to be able to add a lot of automation to assist our local agencies with the work that needs to occur in order to reevaluate. So currently we are reevaluating in these batches our famous moms and famous population, as they are not subject to the maintenance of effort. So while we're doing this on a partial basis now, post-PHE, we're going to include all of the individuals that you saw for age out, or anyone that is on our breast cancer and cervical cancer prevention and treatment act, that's the BCCPTA, or expansion individuals that receive Medicare. So what this batch does is it's going to automatically reevaluate individuals for any other ongoing coverage, and we will authorize approvals, but the process also authorizes those terminations and reductions. So because of the maintenance of effort, that's why we're not doing that at this time. What this batch also does is it will send information. So like we said, individuals that turn 65 or anyone that receives Medicare, we would now be evaluating them for a disability group, an ABD group. With that is a resource test. So what this batch will actually do is it prompts to send information automatically to the customer to gain that information on resources. So again, that's really helping the workload of the local agencies. It takes care of the administrative work of sending out the paperwork, so that way they are able to focus on processing the information. All right, next slide. And then, of course, we can't talk about PHE without talking about the redeterminations. That is actually going to be the largest process for us to unwind. Now, we are very lucky that we have an automated ExParte process. And ExParte is basically completing renewals end-to-end without any involvement from our members. And so as you can see here, we have a little bit of data on our ExParte renewals. And overall, 53% of our population does successfully renew via that automated ExParte process. Now, ExParte is not successful for all of our members for a multitude of reasons. One of the biggest reasons is we cannot ExParte members that have coverage that includes a resource test. However, within those populations that are eligible for ExParte, we see an average of an 80% success rate. So we have looked at the numbers that we are going to need to renew with unwinding, and we do expect those numbers to stay relatively the same as we unwind. One of the big changes we have made with ExParte, though, during the PHE is we were not sending renewal packets. So as I said before, we cannot send any information to the customer to reevaluate their coverage during maintenance of effort. So what we will be doing, and we'll talk about in another couple slides, is we're actually going to be doing a process where we rerun everyone through this process in order to send the packet. And we'll go ahead to the next slide because I think that's where we'll get into that. Okay, so in order to unwind, what we are planning is a phased unwinding approach. This is based on CMS guidance. CMS has given states guidance that they should be processing not only a hierarchy of populations, but also case actions, making sure that you are accomplishing everything you need within one case action. Now, CMS has given us the guidance that we can use the renewal process to also incorporate all changes. However, we are able to do some things before the end of the PHE. So as we talked about the combined redetermination process, right now that process does go through terminations and reductions of coverage. However, what we are planning for November is what we are calling an enrollment shift. For the individuals turning 19, 21, and 26, as well as postpartum individuals in our Medicaid groups, we are able to determine out of those individuals who has income of 138% FPL and lower. So what that means is these individuals would not see a reduction or a termination in coverage if we were to move them from their current group into basically either it's going to be expansion or life fee coverage. So as you can see here, we have a current number of members that are impacted of 16,000. Now, we do expect that number to actually fluctuate somewhat because, again, this is based on October information, and we will have some more information coming in at the end of this month. So what we plan to do is move those individuals from their current coverage where they've been held into their ongoing coverage. And again, this would not be a reduction or a termination. That's really going to help us for unwinding because it's a very large group of individuals that now the local agencies will not need to take care of themselves, and it will allow our larger combined redetermination batch to run smoothly on smaller groups of individuals. We are going to continue this special enrollment shift through the end of the PHE, again, focusing on those certain age outs as well as postpartum. Another thing that we are planning at this point is to do another ExParte cleanup run. Now, it is possible that someone is eligible for an ExParte renewal, however, that renewal failed in the past. There's a lot of different exception reasons to our process, and there is a possibility that while they may have exceptioned out in the past, they could be eligible today. So we do want to run a cleanup run, and therefore we may be able to take care of some of these renewals prior to unwinding beginning. Now, the second part of this, of course, is going to be what we do for renewals and changes ongoing. So at the end of the PHE, we know that we will have a certain amount of time to catch up applications, changes, and renewals. That whole process is a 12-month process. However, with changes, we can fold those into the renewal. However, there are some changes we will be able to process prior to renewal. Unfortunately, like we said, that number is unknown. However, any information that a member needs to report, we do want to make sure that that information is reported, if not already, then post-PHE, so those actions can be taken. And we did touch on this on the last slide, but with renewals, what we are going to do is there's actually going to be a 12-month rolling renewal process. What this is going to do is we're going to use our standard ExParte process and then add additional runs to catch up overdue renewal. So when we go back to the ExParte process after the PHE, that's when we will begin to send all of the forms. We do have a calendar that we are working on for that process, and what that calendar will do is it will also help to equalize out renewals over the year. Some of you may be aware that a lot of our renewals tend to fall towards the second half of the year, especially the last few months of the year, especially with expansion. We did see an increase in applications in the first quarter of the year. Therefore, the renewals kind of back up to that period as well. So this is actually something that should help us to equalize some of our renewals throughout the year, so we're not seeing, again, those bottleneck effects. Okay, next slide. And so, of course, while we're able to plan for a lot, there's still some things that we don't know. And that's where we ask for everybody's help. So, of course, the first thing is there's still an uncertainty to when the public health emergency is going to end. Now, CMS has stated and has given states guidance that they will give us at least a 60-day notice of when the final PHE end date will be. Now, we don't know exactly when that will happen. Like I said, we have the PHE extension through January 16th. And so if we're going to hear 60 days before that, we would hear something mid-November. That's what's been given to us so far. Unfortunately, you know, there's no way to know when it's going to end, but at least having a 60-day off-ramp is going to allow us to start getting ready for unwinding, start getting ready for all the things that need to be turned on that were off during this time. So again, also full official unwinding guidance from CMS has not been received. So we've heard some things such as, you know, bucket your populations, determine how you're going to be able to catch up on renewals. But there are some very specific guidances that still need to be given to us, such as if the PHE were to end on January 16th, when can states start taking those actions to reduce and terminate? So those are some of the nuances to the processes that we still have to receive from CMS. And of course, once we receive that information, that will fall into our planning as well. So we've kind of been doing our plans of month 1 of unwinding or month 4 of unwinding instead of assigning it to a January, February date. One of the large issues that we may face is member contact information may be out of date. Now, because we haven't been performing, you know, the renewals outside of ExParte, it's very possible that some individuals have moved or have changed even their phone numbers and haven't had a chance to let us know about that. And also, since we haven't been sending them the normal mail we would be with reevaluation, we might not know that their address has changed. So we are working on some campaigns we'll talk about in the next slide to help with that unwinding process. And the first push is going to be making sure people update their mailing addresses and their phone numbers. Now, we've been asked this question a lot, and this might be one of the questions that's out there that I'll answer at the end. However, we don't know how many individuals that will roll off of Medicaid. That is because we have to reevaluate someone. Just because a change was reported does not mean that they will lose coverage. So we do monitor anything that's taking place currently to make sure we're protecting our members from losing coverage today. However, because we actually have to reevaluate every member fully, we can't predict at this time who would lose coverage. And again, this is if someone reported a change a year ago, there's nothing to guarantee that their coverage is going to that change is still active. They may have had another change since then. So we cannot use information that was fully provided a year ago in order to take action. We're going to have to reevaluate everyone. Okay, we'll go to the next slide. So this next slide actually touches a little bit on the Unwinding Outreach. And so we've been working through this plan, and a lot of the DMAS staff that's on this call has been key to that process. And so this is basically some outreach through mailing, digital outreach, updates to our website. And so one of the things we are planning is when it comes to that member contact information, we would like to, when we get the 60-day notice, we would like to go ahead and send a postcard out to everyone. It's not going to say that everyone has to take action immediately. It's a heads up, you know, thing. We're getting ready to unwind. Make sure that if you know anyone who's on Medicaid, if they have an address or a phone number that has changed, to let us know about that. So we're also going through and putting together some reinforcement plans to ensure that we're able to actually reevaluate everyone. We know that there are staffing concerns at the local agency level, and this is a lot of work for our state to take on. And so we were very lucky to receive some ARP funding and the American Rescue Act funding. So we have received funding to have a large contractor base that will be eligibility focused, and they are going to help with the renewals, the changes, and the applications to ensure that local agencies do receive support during unwinding. And then, of course, we are working with our sister groups as well on application assistance. We definitely want to make sure everyone understands the renewal process. It's very possible that we'll have individuals that typically ExParte renew whose information may be out of date, and now we have to get an administrative renewal form. And so we also want to target messaging for age-blind and disabled populations. Again, these individuals could have come onto Medicaid during the PHE and have not had coverage before. So we want to make sure that as everyone is going through this process, they have plenty of resources to reach out to as they renew. All right, next slide. All right, I think this is my last content slide. So one of the big collaborations we also are working with is with the health plans. we know the health plans, they reach out to customers, and they also have their own marketing and their campaigns as well. So we are working with them in order to help with our outreach, our direct mailings, their digital communications, their information. They also receive the changes of address and the updated phone numbers, and reminders to complete those renewals. Our health plans are extremely excited to help us with this. We're extremely excited to have them help us with this. We know that, they have contact with a lot of our members too outside of the normal annual renewal process. But however, one thing we do want to incorporate and make a point of is we do want to make sure the messaging is consistent across all of the plans. And so we are asking that health plans actually coordinate with us, and so that way all the language is the same and it meets all of our guidelines of simple language in a conversational style. And that way we can make sure also the delivery of the messages is somewhat similar across the plans. We want to make sure that our members are all getting the same information at the same time. We'll go to the next slide. And I believe the next slide is contact information. So we do have two main contacts for our eligibility and enrollment unwinding. Of course, you can always reach out to myself and Sarah Hatton as well. So like I said, the member engagement, the outreach questions, Miriam Siddiqui, she introduced herself earlier. She would be the point of contact for those questions. And then our eligibility and enrollment questions would go to Cindy Olson, and she is our director of our eligibility and enrollment services. All right, and the last slide is just a thank you, of course, for your time and to go through any questions anyone may have. So I'm just going to look at the chat real quick and see what we might have had come in. Okay, so I did see a question here about the numbers on the slide for the phase 1 and the enrollment shift. So we did originally look at the numbers for that, and you are absolutely correct that the total number between pregnant women and the age-outs is closer to 40,000. Now, we won't be able to evaluate all of those individuals. Some of them do not have the type of coverage that it would result in a reduction or not result in a reduction or a termination. And I can give you an example of this. So like some of our famous individuals, if there's someone who's turning 19 that's in the famous program, they may or may not be eligible for full coverage ongoing. Same thing for famous moms. So that number is very much in flux. So yes, it does look like it's a much different number on the slide than if you were to add up the two different populations. It is higher than 16,000 because, of course, we do have more numbers coming in for that. But you're correct. That number does seem larger when you look at the total population, but that's also reducing the number for those individuals that may or may not actually potentially look eligible for full coverage ongoing. And then the next question I see here, and then I think that might be the last one, and I definitely want to make sure we have enough time for the next presentation. How will DMAS handle return mail for those who update their contact information? And so a lot of the return mail will most likely go back to the local agencies, and we have been working on that guidance as well to work on the return mail policies. One thing that's really important there is, of course, return mail does not indicate that someone is ineligible because we don't, of course, we don't look at eligibility based on their address, but we do have a question of whether or not they're a Virginia resident. And so the eligibility and enrollment staff have been working on their or updating guidance on what steps the agencies must take. Basically, they are responsible for reaching out and trying to figure out if there is a new address or just determining if someone is still in Virginia. That can be a little tricky sometimes because, of course, if you received return mail, where are you going to send another piece of mail? But they are responsible for using any contact methods to try to determine if the Virginia residence still exists. So I know that we'll be getting some more information about that out hopefully soon here. I did not see any other questions. And again, just to make sure we have time for the other presentation, please, definitely send us questions. You've got the email addresses. I see, we'll be sending up a slide deck so you'll have the email addresses. And of course, feel free to reach out to me and Sarah as well. But I think I will go ahead and turn it back to Natalie, and I thank you for your time.
Jessica, thank you so much for that wonderful presentation, very informative presentation as well. And I want to remind everyone, because I've seen this in the chat a couple of times, we will be sending a link out to this recording as well as a slide deck at a later date. And any additional resources that either one of our presenters feel the need to attach, we'll include those as well. All right, thanks so much, Jessica. If you have any questions for her, I think she'll be staying towards until the end of the meeting. Yes, so please feel free to drop them in the chat and we'll try to circle back if need be. Our next presenter is Sarah Cariano from the Virginia Poverty Law Center. Sarah, are you with us?
I am. Can y'all hear me?
Yes, loud and
Awesome.
clear. All right,
Great.
turn it over to you. Thank you so much.
Well, thank you, Natalie. So as Natalie said, my name is Sarah Cariano. I'm a health policy analyst at the Virginia Poverty Law Center, and I also help run our Navigator program, Enroll Virginia, where we do a great deal of work with Medicaid as well as the Affordable Care Act Marketplace. I'm here today to talk a little bit about open enrollment for the Marketplace. And I know it's Medicare open enrollment, it's CCC plus open enrollment. So that phrase, it does apply to like every health plan possible. But today I'm just talking about the Affordable Care Act, which really does impact the state and their Medicaid kind of processes. I'm going to try to highlight, given the group, some of the interactions, some of the things that are similar between ACA eligibility practices and some things that are different from ACA to Medicaid. So now if you go to the next slide, which is just a little bit about VPLC, and then we can skip right to the next one after that. Go straight to the next one. Great. So just a very, very high level overview of the ACA Marketplace. Virginia uses the federal facilitated marketplace, which is healthcare.gov. We have used that since 2013 when the marketplace was launched for plan year 2014 coverage. We are in the process of transitioning to a state-based exchange. What that means is right now the state funds our outreach component. So they fund the Navigator program like myself, and the other one, Vote People SOS, as well as any marketing that you see. That kind of setup where we use the federal platform, but the state is in charge of certain things will continue through 2023 plan year. And then for open enrollment that occurs during 2023 for 2024 plans, we will have our own state-based exchange. So there will be a new website based in Virginia. It's run out of the Virginia Health Benefits Exchange Division, was set up within the SCC. And so that will be a transition that will be interesting and fun for us all to go through together. And we're certainly kind of keeping an eye on that. It is essentially, the ACA was set up to have, a place where people could compare apples to apples plans for individuals who have to purchase coverage themselves, the folks who are buying individual coverage. It uses plain language as much as health insurance can be simplified to help folks kind of understand what they're purchasing and be able to compare plans equally. It was previously really hard because there was different standards. Now that there's a single standard, it's easier to say, oh, in this plan I get this, and in this plan I get this. But here are the differences. The financial assistance, which I'll talk a lot about more later, is only available through the marketplace. So it's only through kind of healthcare.gov or the call center or some very specific partner broker sites. If you buy directly through Anthem or directly through one of the other companies, you're probably not going to be able to get the tax credits. You have to go through the federal kind of platform because the federal government is providing that financial assistance. And so they need to do that assessment themselves. You can do the application and process and see what you're eligible for in terms of financial assistance, as well as all of the plans that are available in your area. And it does not require you to enroll. So it can be really helpful for some folks just to go through the process so that they really can compare all their options so they can make the best choice for themselves and their families. Virginia also is what's called a Medicaid determination state. We made this switch alongside a Medicaid expansion in 2019, where healthcare.gov actually has the ability to determine someone eligible for Medicaid. They will do healthcare.gov will always do a Medicaid assessment before the marketplace, because if you are eligible for Medicaid, you cannot get financial assistance on the marketplace. So they have to kind of ensure that you're not eligible for Medicaid before they give you tax credits. And once it determines someone eligible, they will send that file to the state for that individual to be enrolled. And eligibility determination will not be done at the state at that point. If someone is referred, so the marketplace does their eligibility assessment and they think, we think you're eligible for Medicaid, but we maybe couldn't confirm something. We couldn't confirm your income. We couldn't confirm your immigration status. we're going to send you to the state. And at that point, the state will do a complete determination for that individual. And this is one reason why the state gets a lot more applications during open enrollment, right? A lot of people are hearing about health insurance. So just generally speaking, more people are applying. And then also healthcare.gov is sending a lot of files down to the state for processing. And so, you know, if you talk to the Cover Virginia folks, they're always planning for open enrollment for this influx of applications that they get every year at that time. Next slide, Natalie. So to purchase on the marketplace, it is eligibility just to buy coverage on the marketplace is really broad. You just need to live in the service area. So there's plans are regional. You just need to live where that plan is offered. You need to be a U.S. citizen or national. So this is that lawfully present or legally present definition that Virginia also uses for their pregnant women and children. So you just kind of need to be legally present. The only groups that are excluded essentially are undocumented individuals and individuals with deferred action for childhood arrivals. To be clear, there are other forms of deferred action. Those folks are legally present. They can get coverage. It's just the DACA deferred action recipients that can't and not be incarcerated. So pretty straightforward. Then when we look at who can get the financial assistance, there's some more criteria on top of that. The first one is that you cannot have an offer of other coverage. So I am not eligible to purchase with financial assistance on the marketplace because I get coverage through my job. Individuals who are eligible for Medicaid cannot because they can get Medicaid. The ACA financial assistance, I like to think of it as like the last resort. Once you can't get it here and you can't get it here and you can't get it here, okay, now you can get help at the marketplace. For individuals for Medicare, if you are eligible for premium-free Part A or enrolled in Part A or Part B, it's considered minimum essential coverage and you can't get the marketplace. For folks who don't have 40 quarters of work history and so can't get premium-free Part A, even if they're over 65, they actually can get into the marketplace with financial assistance, assuming they meet the other criteria. You also have to have income above 100% of the federal poverty line. For years prior to 2021, there was a cap at 400% as well. I'll talk a little bit about why that's changed and when it might change back. Also, just to note, because Virginia has adopted Medicaid expansion, the kind of functional level for the vast majority of folks is if you have income above 138, because if you're below that, you're generally going to be enrolled in a Medicaid category. And then there's additional financial assistance in the forms of cost sharing reduction, which lower the deductibles and the costs as folks seek care if they have income between 100 and 200%, 250% of the federal poverty line. And I'll talk a little bit about this additionally a little bit later, but there are special rules for folks who are ineligible for Medicaid based on immigration status and have income below 100%. They can still get, there's only kind of special category that can still get financial assistance below 100% of the federal poverty line. Next slide. So I got ahead of myself a little bit. So I just wanted to note eligibility for non-citizens because it is much more complicated in Medicaid, and therefore it makes it a little more complicated in the marketplace because the eligibility criteria are somewhat linked. So again, this legally residing, who it excludes, those folks who cannot get Medicaid because of maybe they're an LPR with only 2 years of legal presence, they can get into the marketplace even if they have income that would usually make them Medicaid eligible. I've heard a couple of folks recently tell me there's a 5-year bar for the ACA Marketplace. There is not. There is no 5-year bar or any other kind of timeline or waiting period. And so if someone tells you that, tell them to call me because I want to make sure we're getting as many folks that are eligible enrolled. I think there's a lot of non-citizens who don't realize that they could get this coverage and get a lot of help getting it. And my last note is just with the removal of the 40 quarter rule. In previous open enrollments, we've helped a lot of folks who immigrated later in life, have been here for more than 5 years, but never worked in the US. Some of them transitioned over to Medicaid in April when that rule changed, but because a lot had already been enrolled in the marketplace, they're probably going to be surprised when they go into the marketplace this year and they're sent to Medicaid. So I expect there might be a little bit of an increase of those folks being sent to the marketplace and being sent to Medicaid because they've been in the marketplace for a few years and didn't realize that those rules changed. So just something that I'm kind of keeping an eye on for this upcoming open enrollment. Next slide. So this is a little more just about that financial assistance. Again, there's two versions, the tax credits. So like Medicaid MAGI group, so pregnant women, children, expansion, it is a MAGI calculation, that modified adjusted gross income. The little differences is that it is always based on your tax household. It does not have those exceptions that Medicaid has for the different household formations when we're doing that eligibility determination. And married filers are required to file jointly, which is also different than Medicaid. It's based on your projected income for the upcoming year. So when I help folks do an application in a couple weeks when open enrollment starts, we're looking at what we think their 2022 income is going to be, not what their current monthly income is, like Medicaid. Once that someone is awarded financial assistance, they use the benchmark plan to calculate it, but they can apply it to any plan on the marketplace. So they have a lot of options. And then again, because we're projecting for the upcoming year, when people file their taxes, there is reconciliation. So if I got too much, I pay it back. If I got too few, I get an additional tax refund. So it's a bit more of a long-term process than Medicaid, where we're just looking at our monthly income and our monthly eligibility when we're not in the middle of a public health emergency with a maintenance of effort requirement. Next slide. And this is just a little more about those cost sharing reductions to show the chart just kind of shows what it does to the deductible and how it brings that down. And again, this is only available in silver plans, so it is a little more restrictive in which plan someone could enroll in and get this additional benefit. Next slide. And the American Rescue Plan really significantly changed who could get those premium tax credits to lower the premium cost of the plans. As I mentioned, prior to 2021, this year, when the American Rescue Plan went into effect, and actually in the middle of the year, there was a cap. Families who had 400% of the federal poverty line income-wise couldn't get tax credits if they were over that. That cap, and that really created this cliff, especially for older individuals who had more expensive premiums. You know, they went from getting okay subsidies, they could afford the plan, to this cliff where they were having, you know, a $700 a month premium for each person in that couple, and it was just unsustainable. So this 400% cap was lifted. Now they just say the maximum anyone will be expected to contribute to their health insurance is 8.5% of their income, total household income. And so it phases out eventually, but it does not have a hard cliff like it used to. This change was put into effect for 2021 and 2022, so folks will see these additional subsidies for the upcoming plan year. We hope it will be included in the reconciliation package at the federal level that is being debated right now, and that they would be extended. But as of right now on the books, it is just through 2022. There are also enhanced subsidies. So I'll talk about that on the next slide because I have a chart. And then the other kind of impacts of the American Rescue Plan to help make insurance more affordable during this pandemic are listed there. Natalie, you can just go to the next slide. So sorry for the small text here, but the subsidies on the marketplace, each kind of income band, you're expected to contribute a certain percentage of your household income, and that is how the tax credit is calculated. Anything over that, you get a tax credit cover. And if you look at the middle column, it's what those percentages were prior to the American Rescue Plan, and then the third column is what they are currently under the American Rescue Plan. You can see anyone under 150% of the federal poverty line would be able to get a silver plan for zero cost, which, as it kind of the landscape exists now, means they would actually have several options, a couple silver plans, possibly a gold plan, and all the bronze plans, almost all the bronze plans that would be zero cost for them. And then you can see it goes up to 8.5% on the bottom versus 9.83% for folks between 300 and 400, and then continues at that 8.5% above 400%. Next slide. So open enrollment, I saw that question come in. Open enrollment was extended. So the last several years, it was November 1st to December 15th. It was extended this year and it will go through January 15th. But for coverage to start on the first of the year, someone would want to go in and choose a plan by December 15th. Folks who are already enrolled, the vast majority of them can be automatically enrolled to the most similar plan for next year. We encourage everyone to go in and actively shop. The plans change each year. The plan that the tax credits is based on changes each year. So the impact of that kind of tax credit that you get might be different on the plan you're in this year versus next year. Networks change, formularies change. And so we always just encourage everyone to go in and actively shop so that they can ensure they have the plan that is best for them and their family. You also want to update if your income changes or circumstances have changed, because you want to make sure you're getting the accurate tax credit amount so you don't have any surprises when you file taxes at the end of the year. Outside of open enrollment, because the ACA has mandated coverage, has the health plans cannot deny someone any kind of coverage or enrollment because of a pre-existing condition. They then limited the times of year that people could enroll, so it prevents folks from like going skiing and breaking your leg and then buying health insurance. You got to have the health insurance before you go skiing. And so outside of open enrollment, when anyone can enroll, so long as they meet the eligibility criteria, there's special enrollment period. So if you have a loss of coverage, the one we see most often is folks who are leaving or lost a job and they lose the employer-based coverage as a result. They'll get a special enrollment period. Marriage, birth of a child, you're changing a location. So if you're in Norfolk and you move to Bristol, the plans are different. So you'll get a special enrollment period. So you can choose a plan that covers where you are. And you have 60 days before that event and 60 days after. So we always encourage folks to go in before they lose the coverage or before the event so that they can line up the new coverage and prevent any kind of gaps in coverage. Next slide. And then I just wanted to highlight a little bit of one SEP is when you have lost or been denied Medicaid. I suspect, based on everything Jessica said, that there's going to be some folks in the upcoming year who are going to need to access this special enrollment period. And it can be a bit clunky when Medicaid is denied or terminated. They do send information to the marketplace about that individual, and they send information to that individual about the marketplace, but it is not an automatic process. And so if you're working with folks who have lost Medicaid because their income went up, because something else, please reach out to us. We can help them get into the marketplace. We want to make sure that folks don't lose coverage if they are still eligible for something, even if they're not eligible for Medicaid anymore. And just note, if someone kind of starts at the marketplace and is sent to Medicaid and then sent back, they can still get a special enrollment period even if open enrollment has ended. So it can be kind of a complicated process for folks. So please just reach out to our navigator program if you have any questions or need any help with that. I know I work with the folks at DMAS a lot when we get some of these really complicated cases to try to make sure we're getting people in the right place in the right time. And I just have one or two more slides. I know we're getting close on time, so I appreciate it. Next slide is just the information needed to apply. You'll see it pretty much lines up with Medicaid applications. The one important thing is the availability of other coverage. So Medicaid asks for that, but it's not required. The marketplace really does need that information to make sure you are eligible before they give you tax credits, as well as that information for special enrollment period. Obviously, Medicaid enrollment is year-round. We love that, but Marketplace needs you to verify that you have a special enrollment period if you're enrolling outside of open enrollment. So a letter about your loss of coverage or your loss of employment, something like that usually suffices pretty easily. Next slide, I think, is my just contact information on Enroll Virginia's website, and it's actually embedded on Cover Virginia. We have an assister map. It is not just our folks, it's also all the application assisters, mostly the federally qualified health centers across the state. And so if you go to Enroll Virginia and you go to find help, or even if you go to like the Marketplace page or some of the other pages on Cover Virginia, you can find an assister in your community. Our 800 number also, it'll ask for the zip code and it directs you to the local office. And so you should get someone in your community who's familiar with those plans and familiar with your community to be able to provide that assistance. And my contact information, I think, is on the next slide as well as the first slide. So feel free to reach out to me directly with questions, or if you need help or you have a patient or client who needs some help with any of this. And I know that was kind of a lot of information and I went quickly. I was trying to respect everyone's time, but I'm happy to take kind of any questions if we have them. I think the only one I saw come in was about the open enrollment dates. Natalie, I think that's it. So I'm going to throw it back to you unless something else comes in.
All right. Sounds good. So thank you all for being here. I am going to reserve a couple of minutes For anyone who had a burning question and couldn't fit it into the chat, if you want to come off mute to ask it right quick of any of our staff or of Sarah, please do so. I'll pause for a couple of seconds to see if anybody would like to do that. All right, it sounds like everybody did their job. They got all the information that they needed. If since there are no general questions, and nobody has any additional questions to ask, we'll go right into our wrap-up announcements and just letting you know our next meeting, I forgot to put that on the slide, is December 16th at 11 a.m. If you have any questions about, we will be sending out the agenda in so much more time before the meeting so that you'll know what will be discussed during that particular meeting. If you have any suggestions about upcoming topics that we should cover, please don't hesitate to drop them here in the chat or to send me an email. I'll be happy to take them. And I will turn it over to Miriam if she has any announcements, or Jessica or any of our staff have any announcement that they would like to share with the body.
Thank you, Natalie. Thank you, everybody. Sarah, you guys are going to be really busy. This is going to be one of the longer open enrollment periods. So we really appreciate all the work and effort that you guys put into this. Not much to report out other than what you just said, Natalie. You covered everything. I do wanted to, we're going to be quite busy for next few months in terms of just unwinding planning. In December, when we come back here, we do anticipate, maybe an update on numbers, update on what we hear from CMS on the guidance for unwinding. So more to come. So this is not the first and last time you guys will be hearing from us on that a lot. And please send us any questions or suggestions you might have on how we can reach out to you and our members. We would really appreciate that.
All right, that concludes our meeting. We thank you so much for joining us today, and we hope to see you in December. Have a wonderful, wonderful day and a lovely fall.
Bye, everybody.
Thank you, Natalie.